Hello guys, welcome to IMG Doctor. Today we will be discussing about the AMC Clinical examination format. Well, all international medical graduates who are planning to get a general registration here in Australia via the standard pathway must pass the AMC examination. So this examination is basically a two-stage process. The first one is the AMC MCQ examination and the second one is AMC Clinical examination, or you can also go through the workplace-based assessment. However, in this video, we will be just talking about the AMC Clinical examination and its format. So let's talk about the objective of this exam. So the first thing is that this exam assesses your clinical skills. That is history taking, physical examination, coming to a diagnosis, giving differentials, interpretation of investigations, and the clinical management skills. And the second most important thing about this exam is that it assesses your ability to communicate not only with the patients but also their family members. Because in some stations the role players can be the mother or father of the patient, and you need to communicate and counsel them. And there are also some stations like the teleconsultations where you need to talk to other healthcare workers. So what do we need to study? In short, as this is a clinical examination, you need to expect questions from the clinical subjects, that is medicine, surgery, obstetrics, gynecology, pediatrics, and psychiatry. And along with that, you need to expect questions from the allied subjects, that is ENT, ophthalmology, and dermatology. Having said that, it is highly recommended that you go through the medical journals so that you are more aware of the commonly presenting medical conditions here in Australia and also know their treatment guidelines. And along with that, I also recommend that you guys go through the patient education website so that you're able to explain the diagnosis to the patient in a layman's term. And I think that this is more important than mugging up or revising your theoretical stuffs. Now, talking about the structure of this exam, the total duration of this exam is 3 hours 20 minutes, and you can either go for a morning session or an afternoon session. Now, each session there are going to be 20 stations, out of which 14 are the scored stations, 2 are pilot stations, which means that they are not going to be scored, and 4 are rest stations. Now, in order to pass this exam, you need to get at least 10 or more passed stations out of the 14 scored stations. And unfortunately, during the examination, you will not know whether the given station is a scored or it's a pilot. It's only when you get the result that it will be revealed. So when you're giving an examination, you need to give 100% to every station that you're going through. So now each station is going to be a total of 10 minutes, in which the initial 2 minutes is for you to change to the next station and also read the task. And the next 8 minutes will be your assessment time. So in the examination, what's happening is that during the first 2 minutes, you will be standing outside your given station. There's going to be a screen in front of you where you can read your question. The question usually consists of a clinical scenario, and you will be given your task. The task will be of 3 to 4 in number. So during this 2 minutes, make sure you're reading the task and your clinical scenario properly and plan your approach. Unfortunately, at this time, you'll not be given any pen or paper. So you have to do all the thinking process in your brain. So once your 2 minutes is over, you will hear a bell. That's when you need to enter the room. On entering the room, you will be greeted by the examiner, who will check your ID, make sure that you have understood all the tasks, and will also introduce you to the patient. Now, the patient can be a real patient with typical findings or can be a simulated one. So when you are doing your task, the examiner will be sitting behind you and observing your performance and marking you accordingly. When your 8 minutes is over, you will hear another bell. That's when you need to leave the station and move on to the next one. So during this examination, this process will be repeated again and again for each station. So that's it for this video. I hope you found this useful. If you have any queries, please comment below. Thank you so much. Bye-bye.